Today's topic, neurohacking and elite performance practice with special guest, my very close friend, Dr. David Pascal. Welcome to the Hologram Podcast, sponsored and brought to you by Quantum Neurology Rehabilitation. Every major science publication and cutting-edge physicist is describing our universe as a hologram, and I'm suggesting that we recognize and describe the human body as a hologram too. I discuss this more in detail in my book, Holographic Healing, available on Amazon. This podcast introduces life, health, and healing concepts based on holographic principles and how to incorporate these principles into a holographic lifestyle. The hologram means that everything is connected. We are holograms. We know this to be true because the smallest unit in our body is a cell, and each cell contains all the information of the entire nervous system. It has been demonstrated through cloning technology that transferring the contents of one cell into another cell could create a duplicate nervous system. Another aspect of the hologram is that communication is constant and instantaneous, which means that communication occurs to, from, and between each layer of the nervous system, the cells, the muscles, the tissues, the organs, and the bones. On this podcast, we introduce the holographic lifestyle. We examine the concepts of mind, fitness, health through the filter of the nervous system, through its healing and development. The intention of this podcast is to introduce interesting and novel concepts and cutting-edge scientists, doctors, and thought leaders to contribute to your holographic lifestyle. I'm your host, Dr. George Gonzalez. I'm a chiropractor. I'm the founder of Quantum Neurology. I'm the creator of the holographic number theory, the author of the Holographic Healing series, and the creator and host of the Hologram Podcast. This show is for education and entertainment purposes only. It is not intended to examine, treat, diagnose, cure any illness, injury, infection, or condition. It is to present concepts and possibilities that the listener or viewer can investigate further. Concepts presented by doctors and experts are their personal opinions and are not promises or guarantees of outcome. Each person's result may vary. Please take your health into your own hands, do your own research, and ask the advice of an expert when dealing with your own personal health or life issues. Today we have Dr. David Pascal, and we're speaking about neurohacking, an elite performance practice. Dr. Pascal is one of my closest friends. He went to high school here in Los Angeles, California. He's a graduate of UCLA. He was a member of the Santa Monica Track Club, where he was a training partner with Carl Lewis. He's a sub 4-minute miler. He's a champion athlete. He's a father and a chiropractor, and he was the first quantum neurology student and first certified instructor. He's a 2-time quantum neurology doctor of the year and the 2016 Quantum Neurology Ambassador. He has worked with over 20% of the medal-winning athletes in track and field from the U.S. from the last 10 world-level events. Please help me welcome the Dr. David Pascal. Thank you so much for being here, Dave.
Thank you so much. Wow, what an introduction. You're very dear to me, and I'm just honored to get to chat with you again.
Well, as always, thank you so much, David. Today's topic is working with an elite performing practice. And so many doctors out there go into practice wanting to do the best they can and get into sports level care. But before that, they have to have the skills and ability. So what does it take to become an elite level practitioner to begin with?
Well, of course, first you need your basic license. So whether you do that as a medical doctor, doctor of chiropractic, an osteopath, and once you've got that, then you really need to understand the athletic body. Athletes they really are different from, or at least elite athletes have different bodies from the rest of us. And so there are several courses you should be taking postgraduate to learn about athletic physiology, about injuries, and about all the different modalities available, because even if you're not using those modalities, when an athlete comes in and they give you their history, it's important to understand the care that they've had so that you can incorporate it into your own viewpoint as a treating physician.
So, Dr. Pascal, you've worked with some of the elite performers in the world. You've traveled the world. You've been the doctor to several of these award-winning and world record athletes. What kind of concepts are you using that separates you from regular traditional chiropractic and other therapies that people are doing it with these athletes?
Well, I mean, clearly we're bringing something a little extra to the table. You know, as you mentioned, I've been honored to be able to work at the last 4 summer games, to work at the World Track and Field Championships, which are held in between the games. I worked at a total of 11 World Championships, and you know, I'm seldom part of the medical staff. I'm usually the hired gun. The athletes themselves are bringing me with them, you know, to Rio like this last summer, or to Beijing, or to London, and they're bringing me because of the skill set that I have, and the foundation of that skill set is quantum neurology.
I absolutely love it, Dave. We've been working together for how many years now? About 17 years, or going on to 17 years. And that entire time you've been using quantum neurology, working with elite performers and seeing amazing things. And now you were an expert before we met. You were already working with elite level athletes. You were an elite level performer yourself. And so you have that experience, you know, going into it that most people don't. What created a bigger change with quantum neurology than with what you were doing before?
Well, yeah, you know, I was a pretty good athlete back after college, and was able to race all over the world, and that those lessons that I learned competing certainly brought a lot to the table, and then what I learned in school and then the continuing ed courses over the years helped me to be very good and to help my athletes maybe to a greater extent than my other fellow doctors, because of that combination of education and having lived it. But with quantum neurology, you are able to delve into the body at a much deeper level. You're able to get into the underlying functions of the body from a neurologic viewpoint. So if you're a quantum neurologist, if you're using QN, you are able to assess the body at a deeper level, you know, much deeper than any other technique, at least that I'm familiar with, and I've been practicing for over 30 years. You're able to find weaknesses in the body and clear out those weaknesses so that the body functions better. If an athlete comes to you and they're injured, there's no technique that I've found that allows you, that guides you, that leads you to where that injury is in a person's body. What level is it? You know, is it an injury due to an organ or to a muscle or to a joint or ligament or, you know, the brain? Whatever it is, QN will lead you to that. And once you find the underlying cause to a problem, then you're able to fix it much, much faster. So a large number of the people that I see, they've already seen 4, 5, 6, 10 doctors before they ever even come to me. and they're great doctors, but they're working with in a box that was created back in the 1800s. You know, when we were first learning about the anatomy of the body, or really learning about it, and the nervous system and physiology. And since then, there hasn't really been a major breakthrough into understanding of the bodies and into therapies. You know, we have things that, oh, well, maybe if we do this ultrasound, then this setting, it'll be, you know, they'll heal up in 3 months instead of 5 months. But with QN, because you're at that root cause, we'll see people that have been injured for extremely long periods of time, and their recovery time from their injuries with QN treatment is much quicker. I mean, sometimes it's a matter of minutes for injuries that have been there for months or even years.
You know, Dr. Pascal, you bring up a real important point and concept, is that it doesn't take that long to initiate healing in the body. The strategies and techniques that we teach, doctors are able to use a pattern of rehabilitation that's, you know, it's the same pattern of evaluation, but everybody presents with a different pattern of weaknesses. So everyone's getting a unique evaluation and a unique care that is customized to their personal needs. And the speed at which we're able to evaluate is what's so powerful. Dr. Pascal is working with elite athletes, and, you know, he doesn't have a lot of time. He has to see the athlete before their warm-up, after their warm-up, before they run out to their race, after they run out to their race. And he's seeing them multiple times during that day. And he's able to get some phenomenal results with them. And Dr. Pascal, talk about, you know, the different strategies that you overall strategies that you're working with athletes. It's not something that you're seeing them at one visit. So what does, you know, if an athlete were to come up to you and say they want to be under your care, what does that look like for somebody?
That's a great question. You know, I want to help as much as the athlete will allow me to. So they might just want me for their recovery of that one particular injury. Or as you said, if an athlete approaches me and says, I want to work with you, then I'm going to ask them, well, what does that mean to you? Do you want me to just handle you when you're hurt? Do you want me to scan your body for any existing injuries or any weaknesses that may become, you know, injuries? Do you want me to give you nutrition advice? Do you want me to give you, you know, mental advice? Because what you bring to the table, that positive mental attitude, that's a huge, can play a huge role, especially at a world-class level. Do they want me to talk to them about how they warm up, how they integrate their workouts or my care into their workouts? Do they plan on working with other, you know, caregivers? Are they going to work with nutritionists, a sports psychologist, a acupuncturist, maybe even another chiropractor or a physical therapist? So I want to lay all the cards out on the table and then see what they want. If they want me to do it all, I can do it all. If they want me to just be part of their team, you know, then it depends on what role they want me to play in that. But the first step is to find out what the athlete wants or what they think they want, and then tell them what I can provide, and then go from there.
Very powerful. And Dr. Pascal, what's it like to work with the best of the best? You know, I've been with you. I've been honored enough to be invited by you to be with you during some of these track and field events. And I know the experience, but I want you to share with our audience, what's it like to work with the absolute greatest, fastest human beings in the world?
You know, George, it to me, it's amazing. I love working with these phenomenal athletes. they respond so quickly to care. It's like when, the faster you're driving your car, or even let's say your bicycle down the road, the larger the minor adjustments you make are. So if you're riding your bicycle down the street and you're going slowly and you want to turn, you got to kind of move that steering wheel a lot. Those handlebars on that bike a lot to turn. But if you're going very quickly down the street, you just barely move those handlebars and you're going to turn. And that's the same thing with these athletes. Their bodies are so finely tuned that you can just touch them here or touch them there, do this technique or that technique, and their response is just so much greater than the non-athletes that we see. And so that's exciting, you can see the effect that you have on that person just right away. So I think that's the biggest thing is that they're so finely tuned, and all the things that we do, the little things we do have a much bigger effect on them than when you're working on a body that isn't tuned to perfection.
That's wonderfully said. And you're also known for providing care at the speed of light. Could you talk about light therapy and how you utilize light therapy with what you're doing?
Sure. Well, light is a very interesting thing. At first, we thought that light was just that big ball in the sky that lets us see where we're going and warms us up. But actually, we found that, light's broken down. There's a whole spectrum. Part of light we can see, part we can't. And light is energy. And certain wavelengths of light have a bigger effect on the body than other wavelengths of light. We need sunlight. Our bodies must be exposed to sunlight to create vitamin D, right? We need light to communicate. Originally, when the anatomists were dissecting the body and we saw all these wires, these nerves, and then they figured out that they were carrying these impulses, they thought that that's how the body communicated, is through electricity and through these signals that are moving fast, but not at the speed of light, And more recently, what we've discovered is actually every cell in your body emits light, what we call biophotons. And that really the most of the information that the cells are transmitting is through light, not through an electrical impulse. And we still don't understand all of that. We don't know, they haven't broken it down fully what that binary code or what that light code is. But what we have discovered, at least as of now, is that the majority of the information that the body is transmitting is through light. And so when we introduce light in a purposeful way, the right light in the right place, at the right time, with the right wavelength, we can have a tremendous effect on the body. So, quantum neurology, the major tool treatment tool in quantum neurology is light therapy. We're using that light to stimulate the body, to put information into the body so that the body will then adapt or reset to that information and function in the way that we want it to. So we might have someone, let's say one of my athletes comes up to me and they're complaining about their hamstring, the muscle on the back of their leg, and they're saying, "Hey doc, I don't know what's going on, but it's kind of weak." So I can use the standard tests that I learned as a doctor, but then I can use the advanced tests that I've learned in quantum neurology to assess why that muscle is weaker. And then my major therapy is going to be to introduce a specific wavelength of light into those muscles and into different parts of their body to help restore that strength. So light is vital. You know, some people are using lasers, what we call cold lasers. Some people are using LED and infrared. The main tool that I use as a quantum neurologist is called the GRT light, which of course Dr. Gonzalez developed, and it's sending out LED and IR at 635 nanometers. Maybe that's a little too technical, but it's basically in the red spectrum. And that is what the research scientists found is the main wavelength of light that the cells are communicating with. And so, yeah, I guess if you really want to talk to the body or have the body talk back to you, you need to speak the language of communication of the body, and that language is light.
I couldn't agree with you more, Dr. Pascal. Light is a very powerful communication that the nervous system projects. And every cell, you know, Dr. Fritz Albert Popp found that every cell emits biophotons, and that's intelligent light that communicates throughout the nervous system at the speed of light. And it's so powerful when we start recognizing the entirety of the light body, that I call it, the light that's projected off of all the cells, the trillions and trillions of cells in our body, that has intelligent communication. And so we use light therapy as a stimulus to help the nervous system find its communication. It's very powerful and it's very fast. When we evaluate somebody, Dr. Pascal, just to describe a little bit of how quick is your analysis on somebody when you're dealing with them, just to give somebody an idea of the time frames we're talking about.
Sure. Well, I mean, it all depends on how serious the problem is and how deep we're going and what the setting is. So if I'm in my office in Cary, North Carolina, and someone has come in with a complaint, of course, we're going to do our consultation and history, and that's going to take however that is appropriate, however much time is appropriate. And then we're going to do our exam. So it could be, I hate to be so vague, but really it just depends on the detail. You know, it could be a simple thing. Let's say someone had a sprained ankle and we're going to work that up. It's going to be very quick. If we have someone else that comes in and they had a massive stroke and they are wheeled in, you know, and they're unable to move the entire right side of their body, well, that's going to take a lot longer. But the great thing about the protocols from quantum neurology is however long it takes, it's probably a tenth the amount of time using the QN techniques that it would take if I use the classic inside the box, old school neurologic orthopedic approach.
You know, and that's been our experience, and this has been our experience for several years now. And Dr. Dave Pascal was my first student in quantum neurology. We met at the very first conference that I spoke at, and we've been fast friends and together ever since. But when we're talking about these things we're talking about are strategies of rehabilitation. They are not promises or guarantees of outcome or result. Every person's results may vary. And these are just important principles of rehabilitation that we found to be so important. The ability to strengthen every nerve level of function in the nervous system. Understanding that the brain and the spinal cord have nerves that branch off, and every nerve that branches off goes to muscle, tissue, organ, and bone. And when we understand the organization and the patterns, we're able to affect change in a positive way by stimulating the body's natural actions and reactions to achieve a desired result. Now, Dr. Pascal, you've been doing quantum neurology for the longest of anybody, 17 years now. And you've had the pleasure of doing this on the best performers in the world, the fastest runners, the highest jumpers, and the world record holders. And you know, the thing that really touches my heart is that you've been able to apply these principles to severely damaged patients as well. Would you mind talking about that part of your practice, the part of practice that may not be as glamorous but is still very fulfilling?
Sure, absolutely. Yeah, you know, working with athletes is fun. You know, it's exciting, and you get at least for me, how we're doing it, we get to fly all over the world, and you know, there's TV and there's pageantry, and you know, that's exciting. But that's not why I wake up in the morning. You know, that's not why I drive to work every morning. I just started my 31st year of treating patients. Last month was my beginning of my 31st year.
Woohoo! Congratulations.
Oh, thank you. Thank you very much. And when I drove to work this morning, I was as excited in my 31st year as I was 3 decades ago. And the reason why that is because of the majority of the patients that we see, and those are the ones with severe neurologic injury. You know, maybe they had a stroke, maybe they fell off of a cliff, maybe they were in a terrible car accident, maybe they had a spinal cord tumor, brain tumor, some horrible, awful thing, some degenerative autoimmune or neurologic issue like ALS or Parkinson's or MS, and or even people with, you know, functional problems, you know, like their thyroid or you know, chronic fatigue. And with quantum neurology, we're able to help most of these people. I mean, I can honestly say that most of these people that come in with these severe problems, we've able to significantly help. Doesn't matter if they have a stroke. It doesn't matter if they were paralyzed. And the excitement to be able to help someone, you know, that's been deaf for 50 years or that had a massive surgery and now they can barely speak, or, you know, someone that, you know, can't walk and then you help them walk again, or someone that can't dress themselves anymore to help them be able to brush their teeth or button their blouse or hold a cup of coffee. You know, that is such an extreme privilege to get to do. And I have that privilege because I'm a quantum neurologist. You know, a lot of doctors out there, a lot of therapists, they see paralyzed people. They see people that are in pain. They see people with degenerative conditions. And, you know, some of them are able to help. But the percentage of people that they can help is quite limited. And the amount of time that it takes to help them is quite often astronomical. And QN allows us to help a far wider range of people and help them in, you know, there's a reason why the slogan on my door is care at the speed of light, as you mentioned earlier. You know, sometimes it's just that fast, you know, it's just amazing. And if I hadn't seen it myself, I would find it difficult to believe. And so all I can say is thank you. Thank you so much for creating all of this for us, Dr. Gonzalez.
Absolutely my pleasure, Dave. And thank you for taking this work on. It's been such a journey. You know, the ups and the downs we've been together on for so many years. And, you know, at the end of the day, all the downs are worth it because of the amazing healing that we've been witness of. And again, we can't promise or guarantee these results, but when we provide a strategy of rehabilitation that has worked on elite performers, has worked on disabled athletes or disabled patients, it's very likely that these strategies may work for you as well. You know, it's such a powerful concept. And we invite you to learn more about quantum neurology. We invite you to look up a doctor near you. Go to quantumneurology.com, check out the doctor locator and put in your zip code or your city. And you may have to increase the search radius if there's no doctor near you. But check out Quantum Neurology. It may be able to provide you with solutions that, with rehabilitation strategies that you've never been exposed to before, and may be very helpful for you. And for doctors out there, Dr. Pascal, you know, people hear the word quantum neurology or neurology, and they get really scared. They think this is really complicated, hard stuff. Could you put into context what this has done for neurology in general for you, and you think it's doing for everyone else?
Sure, absolutely. You know, first, another thing I'd like to put in context is when you say, you know, we've known each other for so long and we've had ups and downs, you know, and that's true. But our downs are that people just don't believe us. You know, they think that it's too good to be true. And my biggest battle every day is that, you know, just last week I had a woman come in, 68 years old. Her problems are so severe. She had some serious neurologic issues since the birth of her first child over 30 years ago. And now she's on about 8 different drugs. She wakes up every morning and has to take methadone. I mean, that's what they give to people trying to get off of heroin, right?
Wow.
She goes through her entire day taking this entire regime of these painkillers and you know, different drugs to try to tone down her nervous system. And she's been all over to try to get help. And she finally came into us last week. And I did my exam and I told her what I thought was going on. And I gave her her first treatment, and her pain went to 0 in her first treatment. So she goes home and she tells her husband, and she comes back the next day, you know, so I can see how she is. And I said, well, how long did you have relief for? And she said she had relief for about 4 hours. And I said, yeah, that's, you know, typical. You've had a problem for 30 years. You know, that's a great start. And it tells us we know that we can help. So I gave her her second treatment, and she went on home. And then her relief was 12 hours after her second treatment. So I asked her, you know, well, what do you want to do? And she said, well, I said, what did your husband think? And she said, well, my husband isn't sure that he really wants me to have care because he doesn't, you know, he's an engineer and he doesn't understand what you're doing. And that, you know, I've heard nonstop for the last 17 years I've been doing QN, because people think of things from their own educational context. And what you've done is you've advanced healthcare, you know, 50 years in the future. And it's just like when we first started using light therapy in the United States, the FDA hadn't even approved it yet, even though they've been using it in Europe for 40 years, you know, and finally in 2001, the FDA goes, okay, yeah, wow, this stuff really works. And when we started treating patients and giving lectures and talking to other doctors, they're like, what are you doing? That's, you know, that doesn't make any sense. That can't possibly be, because they're just speaking from their context, you know. There was hardly any healthcare providers in the United States using light therapy or lasers. And now, just turn on the TV. You know, every dentist, every orthopedist, every physical therapist, you know, worth their salt, they're all using lasers and light therapy. But you and I went through a whole, that first decade was pretty rough because we were on that leading edge. And that's kind of like that the downside, the tough side that you alluded to. But now, you know, you can go, hey, yeah, I use laser, I use light therapy, and everyone's going to go, oh yeah, everybody does that. My dog groomer does that. So
it's funny because in the past I used to have to explain what light therapy was to everybody, and now I just say, hey, do you know what light therapy is? And everybody says yes. And
right.
Remember that, Dave?
It's so true. Society is finally caught up, and that's just the way that it is. Someone's got to be first, and those people take the hit. But if it's the real deal, then it spreads through, whatever that field is, in our case, the healthcare field. And then people finally go, okay, yeah, we see that's the research and it's effective. But if you're looking now, at learning how to use light therapy, learning how to help your patients better, and like you said, you hear the term quantum neurology. There's some programs out there where it takes 2, 3, 4 years to learn it, and then maybe double that time to master it. You've got to spend hours and hours and hours to memorize every little cell and pathway in the body, and because they're teaching the old school way. It's kind of like saying, I'm sorry, you can't have a driver's license until you know how to, mine your own metal and build your own car, each and every part. You don't have to know every engine part to be able to drive your car. And with QN, certainly we know every part, but we don't have to build it from scratch. And if you want the way that Dr. Gonzalez has set up the training, it's amazing. You can go online, or you can come to a seminar, and on Monday morning, you can apply that information. You can work up a patient from a neurologic, from a quantum neurology viewpoint, and you can understand what's going on with them and your role, and you can treat them, and you can see the difference from day one. And there's not another neurologic technique out there that can do that. And I've been fortunate to be the only other person besides you, Dr. Gonzalez, as you well know, to get to teach your work. And so I've seen it from both sides, as the student learning and as the teacher, enlightening other doctors to your brilliant work. And people learn quick. It doesn't matter what your background is. Even if you never took, well, of course you took neuro in school, but if you don't remember any of that, or it was 10 years ago or 30 years ago, when you go through the program the way that Dr. Gonzalez set it up, you will be able to understand it, and you will be able to apply it, and you will be able to do that the day that you learn it.
That's right, Dr. Pascal. And one of the other things that quantum neurology is really powerful for those that are in school learning for the first time. And what quantum neurology will do is it'll give you a framework of understanding the nervous system, and then all the information that is learned in biochemistry and anatomy and all the different subject matters have a place to rest into the framework of the layout of the nervous system. And I was so honored to have Dr. Pascal's son, Taylor Pascal, become one of our students in quantum neurology, and he's almost done with school. And one thing that's very powerful, and I'm honored in, is that a father always gives his best to his son. And Dr. Pascal brought Taylor Pascal to quantum neurology. How does that feel, Dave, to have your son taking on this work and following your footsteps?
Yeah, well, we all love our children, and I certainly love both of mine, and I'm so proud of them and the decisions they've made in life. And a lot of people go, oh, you're a chiropractor and a quantum neurologist, your son followed in your footsteps. But actually, he didn't really follow in my footsteps. He thought he wanted to go a different direction. He always liked to hang out in my office and see me work on people. He loved all the miracles, but he didn't really think that becoming a chiropractor or working with all these severe patients was right for him. And he was in our office on a spring break. We had a patient come from Moscow, from Russia. He had suffered a massive stroke, and he came in a wheelchair. And my son, assisted me with a lot of the care on that first day. And the second day, the Russian came back with a walker, and we did some more work together on him. And the third day, the Russian came back with a cane, and we did some more work on him. And on the fourth day, he came in on without any support, and it was just amazing. And he stayed with us for about a week and a half, and then he went back to Russia. He came back during the summer, and we did, my son was on break, and we did some more work together with him. And it was so great to just have that side by side together. And then we went to the U.S. Olympic trials, and my athletes did very well. I think we placed like 14 of our athletes on the London team. And then about 2 months later, I got a call from my son, and he's like, "Dad, I get it. I understand how you're helping people, across the board, whether they're an athlete or someone that's been severely injured. And I see that this is a path that I want to go on, but he got there on his own. I never once said, hey, do this. And I'll never forget the day that I, called you and told you what Taylor had said. And then you said, a little shortly thereafter, extended him the opportunity to get to learn quantum neurology. And, he's got 6 months left. He's in the clinic now down in Palmer, Florida, where I guess about 10 months left. He graduates in December. And, he's able to bring that information that he learned in our clinic and in your classes to the patients that he's seeing now. And it's just, I'm just so honored and proud to get to see him do that. So thank you again.
Absolutely. And I'm so proud and honored too. I remember when I first met Taylor, he was shorter than me, and now he's a good foot taller than me or so. Yeah. And, it's just amazing being able to, literally watch him grow up and become a doctor. And I'll be honored to hand him his Quantum Neurology Certified Practitioner's Certificate. And I see that coming in the near future. I'm very excited for him and for Quantum Neurology as well to have him on board. Dr. Pascal, we're going to call it a day right now, but I truly thank you for being my guest today and sharing your stories and wisdom about all the work that you're doing. This podcast is sponsored by Quantum Neurology, and you can check out my book, Holographic Healing, on Amazon. And you can also follow the link in the description box below for our free ebook on lymphatics, and that'll teach you how to process the lymphatics in your system to help your body heal faster. Quantum Neurology is nervous system rehabilitation, and at quantumneurology.com you can find the nearest practitioner. Just enter your zip code or your city, and you may have to increase your search radius to find the nearest practitioner to you. At Quantum Neurology, we have doctors training. We have DVD, live, and online training available. Doctors get started with our Quantum Neurology Essentials package, and you can learn the step-by-step rehabilitation strategies and all the way to get certified in quantum neurology. Doctors learn strategy from restoring muscle strength, structural correction, sensory and cranial nerve integration, and much more. Upcoming events are February 16th, 17th, and 18th. We have Module 1 and 2. Visit quantumneurology.com for our full 2017 schedule. We also have in our Quantum Neurology Home Care series, How I Healed My Back in 2 Weeks. Check in on our website for that information. And if you like what we're talking about, please email us at info@quantumneurology.com. We're thinking about having a membership where we have videos in more detail on how to perform some of these neurohacking strategies and much, much more. Please be sure to visit us at quantumneurology.com for more information. Be sure to sign up for our newsletter to get updates. Visit and like Quantum Neurology Rehabilitation on Facebook and on your YouTube. Please like and subscribe and ring the bell to the Hologram Podcast. Thank you so much, Dr. Pascal, for being here. I love you and I miss you. I look forward to seeing you soon. And for everybody out there, I want to finish with a quote from my book. A rainbow is a holographic projection of light through water. Life is a holographic projection of light through our nervous system. This demonstrates the hologram that we live in and the hologram that we are. I hope to see you next time. Thank you so much. And it's the Hologram Podcast.